Salams and welcome. Thank you for joining me in part 18 of breast cancer awareness, and we're looking at the basics of breast cancer, the psychology of breast cancer, and the importance of addressing the psychological needs, the social needs, the emotional needs, the physical needs, and the spiritual needs of patients. The importance of addressing psychological needs improved if the person is psychologically prepared or in a better frame of mind, then there is improved compliance with the various treatment options. So addressing the psychological distress can make it easier for women to adhere to their treatment plans. And this applies to men as well, that it is important to get an understanding of where you are with the news. So sometimes people go through the same stages of grief. The Elizabeth Kubler-Ross said that where you go through a stage of when a doctor says you've got cancer, you may go through the stage of denial or anger or blaming yourself or blaming others until you come to the stage of acceptance. And it is when you've come to the stage of acceptance, when you are embracing your illness, that is when the person or the patient is in a better frame of mind to adhere to the treatment regimen. It is important to address psychological needs because it leads to a better quality of life. Managing the psychological impact of breast cancer can lead to a higher overall quality of life because now you are now saying the cancer does not control me. I am in charge of my life. I am the same person that I was before, and I will decide how my life is run without allowing cancer to take over all aspects of my life. And then finally, addressing psychological needs is important because it leads to positive disease-related outcomes. The research suggests that psychological interventions can positively influence the disease-related outcomes. If a person is in a positive frame of mind, then the outcome or the treatment options or the response of the patient to the treatment is much, much better. In summary, breast cancer is not just a physical illness. It has profound psychological implications for the patients and for their families. Hence, recognizing and addressing the psychological needs is essential for improving overall well-being and promoting positive outcomes throughout your journey through cancer. It is also important, and as what I mentioned in previous episodes, many people find a spiritual awakening very, very important. And as far as Muslims are concerned, Muslims attach themselves more closer to Salah in the Quran, whereas non-Muslims then have an increased awareness of self and of spirituality, and they find more closer links towards God or God consciousness. Stay well, look after yourself. Alhamdulillah Rabbil Alameen.